And then I'll go to sharing the screen. Here it is. And then there is a there should be full screen. So is it visible now?
Yes,
Yes,
ma'am.
not full screen.
Is
You
it
can
full?
see that.
Not in full screen, ma'am.
No, not in full screen. Okay. So one more time. Now, is it full screen?
Yes.
Okay, great. So we are starting the next unit, Unit 7 today, and this is about parents and young children. I would like you to have a look at the first slide. Here you can see several pictures. And let us think what is happening in each picture and how do adults and the children interact in each situation here. What about picture A? What is happening here?
I think they are taking a patient to the hospital from.
Okay. And so the mother is taking the child from the ambulance car just to, and is carrying him to the hospital, right?
Yes.
What do you think? How does the child feel?
Maybe a little scared.
So a little scared, but does he feel safer just together with his mother?
Yes, I
Yes,
think.
ma'am.
Okay, what about the second picture? Where are the people?
In the hospital, in the hospital room.
So maybe in the hospital or maybe at home, right?
Doctor came to home.
Because both of the parents are here and the doctor is talking to them. And how does the child, is the child at ease here?
Yes.
Why do you think she's at ease?
Because her parents are here and I guess she's playing or watching something.
Yes. So we can see that something wrong with her hand, but anyway, she's calm and feels comfortable. So, okay, she's not afraid of anything. And so if we have a look at the next slide, here we have 3 more pictures. In picture C, how can we describe this situation?
I guess
She's scared of that injection.
So because the boy sees the syringe, right? Okay. And what does the mother do in this situation?
calming him down.
Okay. So and so picture D now. Where are they?
I think they're discussing about the reports of tests.
Okay, yes. And what about the child? Is the child at ease?
He's a bit scared, I guess.
So did the doctor do anything just to help him in this situation? What do you think?
He
So
might have given him a toy.
yes, so just to To come down. Okay, and so picture E here. What is happening here in this picture?
The patient
child
is in
is
critical.
severe condition and the parent is tensed.
Yes. Anyway, the parent just is near the child just to be there when the child wakes up. Okay. So, and the question, the environment for treating children needs to be made different from that for treating adults. Why? Why do you think it's important?
Mind maturity is different from child to adult.
And how should be the environment organized for treating children?
They should have the things which they like around them, and mainly, if possible, the parents with them, so that they can calm them down.
Yes. Okay.
And I think in most of the hospitals they have a children's playroom, a small playroom, so that they can be at ease without being tensed or something like that.
Okay. Any more ideas?
Specially trained nurses for the children's use.
Okay, so and if we are speaking about the place where the doctors just see the children, how should be the place organized? So we were speaking about toys, right? That sometimes toys can just help the children feel comfortable. The bright colors on the walls and posters, just to distract so their attention from something unpleasant, right?
Yes.
Okay. Well, and there is some statistics here on this slide. So you see that this is statistics from the United Kingdom. Patients who are less than 15 years of age make up 20% of the average GP practice in the UK. So 20%. And the under fourth patients consult their GP more than any other age group, except the elderly. So I understand that we don't have exact, we don't have exact statistics for your country, but what do you think? Is the pattern the same in your country? So you see 15 years old, less than 15 years of age, make 20%. This is a very good percent. Taking into account that they are young and should be healthy, right? Healthier than the elderly people, for example. But you see that children under 4 years old, they consult so doctors more than the elderly people.
I think yes, because most of the children get infections more easily than the elderly people. And for vaccinations and all, they visit GPs.
Yes, this is one of the reasons. So why so the under fourth just consult the doctors, the pediatricians very often because of the vaccination. Okay. And in your own country, so the babies are vaccinated, right?
Yes,
and I think that situation is similar to what is there in the United Kingdom. Okay. Now, the question. So which areas do you think should have priority in any modern health spending? Child health, geriatrics, or technology? So if we compare spendings on child health and spending on elderly people, or government state spending on technology, what should be given priority? What is more important?
Child health, I guess.
Child health.
Why?
Because they are very sensitive to the diseases and all, and they need a hygienic environment in their hospitals and all, so that they'll not get infected.
Okay. So they should be vaccinated just to be healthy during their future life. Okay. What about elderly people? Should the state spend money to elderly people to help them?
I
Yes,
think
ma'am.
in every of the examples, like child health, genetics, whatever, and technology, because all of three are useful.
And what do you think of technology? Why is technology important?
For the better treatment of patients, to improve the technology, so that for treating many diseases, complications of the patients.
For example, suppose if there is no technology here, like, so most of the people are going to other countries to get the treatment because their technology is so good. That's the reason most of the people go for the treatment to other countries.
Exactly. Yes. So, and the government should take care of their own people and develop technology in such a way, helping all the other groups, children, adults, and elderly people, right? Any more ideas? I see that only three students are speaking. What about the other? Are you still here?
Yes, ma'am.
Okay. So do you
Yes,
have
ma'am.
anything to tell us?
Yes, ma'am. I guess technology and geriatrics, because nowadays modern technology is really helping doctors in achieving their goals, especially in diagnosing the diseases. And these modern machines, they are really expensive, and not everyone can afford it.
Okay. So more ideas? Okay, good. So, and now let us speak about qualities of a good pediatrician. Here is the table. So with some adjectives, you can see that there are positive adjectives column and negative adjectives column. So they are given in the just pairs, and we should complete the missing adjectives. For example, in the first line, you can see the adjective, positive adjective, patient. What should be the negative adjective? So linked with patient.
Impatient.
Exactly. We just add the prefix here in this case, impatient. Please just look at this table, think of the missing adjectives, and write them down, please, on paper. So complete this table in written form. Just a couple, 2 minutes for you to do this task, please. Everyone, because we'll need the adjectives later to complete the sentences. 2 minutes, please. Okay, so let us listen to Pradeep. Are you here?
Yes, ma'am.
So read the adjectives in pairs, please. Patient, impatient, then?
Patient, impatient. Nervous means confident, ma'am.
Yes, confident and diffident. Then?
Yes, ma'am. Efficient means inefficient, ma'am.
Okay.
And reliable means unreliable.
Unreliable. Mhm.
And,
What about sensitive?
sensitive means insensitive, ma'am.
Okay.
Honest means dishonest.
Mhm.
Dishonest.
And the last one?
Respect of,
There is the prefix dis here. So
yes, respectful, ma'am.
yes, respectful, disrespectful. Okay. Of course, if we speak about qualities which a good pediatrician should have, we need to focus on positive qualities, positive adjectives. But it's not always the case. Now, if we have a look at the next slide, here are some sentences. Let us just look at the sentences, just to understand the situation and think which adjective describes, which of these adjectives that we have discussed describes better the personality of these people. So, for example, the first one is for Rohita. Are you here? Rohita?
Yes, ma'am.
So please read the first situation.
Yes, ma'am. First, Dr. Manshuli is very dash in everything she does. She prepares for her ward rounds methodically, and everything is where it should be and in order.
Which adjectives is just suitable here?
Confident. Confident.
Confident. In order. So any more ideas?
I think confidence is correct.
Sorry? Will you repeat?
Efficient.
Efficient, yes. Efficient is better here. So Dr. Manson is very efficient. So look at the other sentences and write the missing adjective. So the adjective that better describes these people. So also just 2-3 minutes to you. Start, please. Okay. So sentence number 2, let us listen to Suhita.
Yes, ma'am. Dr. Mubarak is a very dash sort of person. He does things quickly and often makes the parents and children nervous by showing he wants the consultation to end. He is a very impatient sort of person.
Exactly, yes. Well, now please, Afnan.
Dr. Andrews is very nice to all patients. He greets them properly and takes their wishes into account. Doctor is very polite to all the patients.
Polite. And if we use one of the adjectives from the table that we have done, so which adjective is better to use here?
Respectful.
Respectful. This is the synonym of polite. Good. So the next is for Hadija, please. Hadija, hello, are you here? No. Humanesh?
Yes, ma'am. Dr. Chandos is not very rash with himself. He finds it difficult to admit weakness while showing off his strengths. Being realistic about weaknesses helps us to learn and develop our skills. Maybe efficient, ma'am. Not very efficient with himself.
Efficient with. So he doesn't want to speak about his weaknesses. So he has some weaknesses, but doesn't want to show just them. He's not realistic about his weaknesses. So any ideas about another adjective to use here?
He's not very honest.
Not very honest with himself. Yes, maybe he's honest with other people, but not with himself. Okay. So is Musharafuddin here? No, Musharafuddin. Now Mayuka, please.
Yes, ma'am. My colleague can be very insensitive. She annoyed the patients when she referred to her husband and she wasn't married. The patient was quite upset. Insensitive.
Insensitive, yes. Not emphatic. Okay, so the next is for Irina, please.
It's not easy to feel efficient the first time you do something new, but with practice, you begin to feel very good about it.
So remember how you feel when you do something for the first time. So people get lost. So the opposite of this is, so people get nervous. The opposite of nervous, what is it? What did we write?
Confident.
Confident, yes. It's not easy to feel confident. Okay, Pargavi, please.
Yes, ma'am. Dr. Kamra sensed that the team thought she was unreliable because she let them down. She made mistakes on the ward and was late on several occasions.
Unreliable. Good. So this is about several people and their qualities. If we think about qualities of a good doctor, not just a pediatrician, so what are the qualities of a good doctor? Let us make a list of these qualities. Just apart from, yes.
The doctor should be confident while treating a patient and should be patient, should have patience.
Should have patience, okay.
And
Why?
they should be sensitive about the patient's feelings also.
Why is it important?
If he is not patient, how could the patient listen to him or
How could a
Wow.
patient deal with impatient doctor? Yes.
patient?
Okay, I see. Any other qualities? For example, a pediatrician. So patience is good both for pediatricians and other doctors. What qualities are specific for pediatrician? Should a pediatrician be playful, for example,
Yes.
Yes, ma'am.
to be able to deal with children, to make them relax, right? So,
Yeah.
Should he be more for example, should he be easygoing?
I think yes.
Okay, so friendly, right? It's very important for especially doctors who deal with children. Okay.
More patience.
Yes, more patience, because why? Why should they be more patient?
Because they are dealing with children, so they might not listen or
And yes, that sometimes the children are naughty, and sometimes the children do not understand.
cooperate
So
with them.
yes, what kind of disease they have. Okay, right. So let us move to the next slide. And here there is the story. So it's my job, Dr. Nasreen Ahmed. Let us read this story just to get some information about this doctor. She speaks about herself, and then we'll do some tasks on this text. So, Vidya, please read the first part.
Yes, ma'am. My name is Dr. Nasreen Ahmed, and I work as a pediatrician in a Central Auckland, New Zealand hospital. I have always enjoyed working with young children and their parents. One of the main factors that led me to consider specializing in this field was my own experience of bringing up my two young children. The understanding that this has given me has helped me to empathize more with parents when they become very anxious.
So this is the general information, what she says about herself, her family, and so what helps her to empathize with her patients. And the next part of the story, so there are a lot of just diseases which is not easy to pronounce. Let us listen to Lahari. Read it, please.
Yes, ma'am. Bringing up my own children has made me acutely aware of the parental fear of potential threats throughout childhood from infant diseases. Illnesses like infections, parotitis, varicella, morbilli, rubella, pertussis, acute laryngotracheobronchitis, rubella, meningitis, poliomyelitis, and tetanus. And then there is a parent's apprehension associated with vaccinations like MMR. If I were not a doctor myself, I would probably feel as concerned and fearful about my own children as many of the parents I see who want to discuss combined vaccinations for their children.
Okay, so, and here there is the abbreviation MMR. What does it stand for? So this is the
Measles, mumps, and rabies.
Exactly. Okay, and so if we look here, this slide, here are some sentences about Dr. Ahmed, but something is wrong in each sentence, and we should change one word in each sentence to make them true. to change the meaning. So, Manish, please, the first sentence.
Dr. Ahmed has never enjoyed working with young children and their parents. Has enjoyed, like we need to remove the never word now.
Yes, we need to remove never, or we may say always enjoyed, has always enjoyed working. Okay, so the second sentence is for Pradeep.
Yes, Dr. Ahmad has no children of her own. Remove no, ma'am. There are 2 children.
Yes, she has 2 children of her own. Okay. The next is for Rohita. Rohita.
Yes, ma'am. Yes, ma'am. The experience of raising her own children with Dr. Hamid is fairly conscious of the fears faced by parents throughout their children's childhood.
So the sentence
Yes, ma'am.
says, what should we change in this sentence? So it says, is fairly conscious.
Aware of parental fear of.
Is she fairly conscious of the fears? Or let us try to change the word fairly. So what does she say? So she says,
Aware of parental fear of the potential person.
She says, made me acutely aware. Yes. So we should change fairly into.
Yes, ma'am.
Into what? Who can help us?
Acutely.
Yes.
Aware.
Acutely aware, acutely conscious. Okay, Bhuvanesh, please.
Unit 7.
Sentence number 4.
Yes, ma'am.
Yes.
Dr. Ahmad feels that being a doctor possibly makes her less worried about vaccination for her own children. He possibly makes his less worried about vaccination for his own children.
Okay, so probably, yes. Instead of possibly, we can use it probably here. Okay, and so the next is for Suhita.
Yes, ma'am. All of the parents Dr. Ahmed deals with are anxious about vaccinations. Many of the parents Dr. Ahmed deals with are anxious about vaccination.
Okay, not all of them. And so, yes, so this is the information about Dr. Ahmed. And so just to do the next task, we need some more time, more than 2 minutes that we've left. So, okay, now let us just stop here the demonstration. Let us now just take a break.